As an EMS provider, you are often the first point of contact for individuals in crisis, and it's essential to be prepared for encounters with patients who may have autism spectrum disorder, ASD. Autism is a complex neurological and developmental condition that affects how a person communicates, interacts, and responds to their environment. Individuals on the spectrum may exhibit a wide range of behaviors, reactions, and needs, which can sometimes be misunderstood during emergency situations. This training is designed to help you recognize common behaviors associated with autism, from communication differences and sensory sensitivities to repetitive movements and challenges with social interaction. You will also learn practical strategies for communicating calmly, clearly, and respectfully with individuals on the spectrum, even under high-pressure circumstances. Additionally, this course will cover how and when to modify your standard EMS approach to create a safer, more supportive experience for both the patient and your team. By gaining these insights, you'll be better equipped to ensure ethical, patient-centered, and compassionate care for individuals with autism, helping to reduce anxiety, avoid unnecessary escalation, and promote positive outcomes during every emergency response. Autism spectrum disorder, or ASD, is a complex neurodevelopmental condition that affects approximately 1 in 36 children in the United States, as well as a significant number of adults. Because autism exists on a spectrum, individuals may exhibit a wide range of behaviors, sensitivities, communication styles, and cognitive abilities. No two autistic individuals are exactly alike, which can make interactions challenging, especially in high-stress environments like emergency medical situations. For EMS professionals, understanding autism is critical. Emergency situations can be overwhelming and even traumatic for individuals on the spectrum, who may struggle with sensory processing, communication, or changes in routine. These challenges are often magnified in the presence of sirens, bright lights, crowded scenes, or the urgency of medical intervention. Misinterpreting behaviors such as a lack of eye contact, delayed responses, or resistance to touch can lead to increased stress, delayed care, or even unnecessary restraint or sedation. By learning to recognize signs of autism and adapting your communication and care techniques, EMS providers can reduce anxiety and minimize trauma for autistic patients. This not only improves the quality of care but also enhances safety and outcomes for both the patient and the EMS team. In this course, we'll explore how autism presents in emergency settings, identify strategies for effective communication and interaction, and provide practical tools to ensure compassionate and competent care for individuals on the spectrum. Individuals with autism spectrum disorder, ASD, often display a unique set of behaviors and responses that may differ significantly from what EMS providers typically encounter in emergency situations. Understanding these characteristics is essential for delivering compassionate, effective pre-hospital care. One notable behavior is the avoidance of eye contact. While some may interpret this as a sign of disinterest, dishonesty, or uncooperativeness, it is important to recognize that for many individuals with autism, avoiding eye contact is a way to manage sensory input or social anxiety, rather than an indication of disrespect or defiance. Another common behavior is repetitive movements, also known as stemming. These may include actions such as hand flapping, rocking back and forth, spinning objects, or repeating phrases. These movements can serve as a way for the individual to self-regulate in response to stress, fear, or overstimulation. In the high-pressure environment of an emergency scene, these behaviors may increase, and while they may appear unusual, they are often a coping mechanism rather than a sign of medical distress. Sensory sensitivities are also a major consideration. Many individuals with autism have heightened or unusual responses to sensory stimuli. Flashing lights, loud sirens, engine noise, the feel of equipment or stretcher straps, or even strong odors can trigger sensory overload. This can manifest as panic, withdrawal, aggression, or complete shutdown. To minimize this, EMS providers should reduce stimuli whenever possible, such as lowering siren volume when safe, turning off bright lights inside the ambulance, and speaking in a calm, soft tone. Even seemingly minor adjustments can make a significant difference in helping the patient remain calm and cooperative. Communication challenges are another key factor. Individuals with autism may have delayed speech, limited verbal abilities, or may be entirely nonverbal. Others may have extensive vocabularies but struggle to process language under stress. They may interpret language literally and have difficulty understanding abstract phrases, sarcasm, or idioms. EMS personnel should use clear, simple, and direct language, allow extra time for responses, and avoid asking multiple questions at once. Visual aids or gestures may also help, and involving a parent, caregiver, or companion, if present, can be invaluable in facilitating communication and ensuring that the patient's specific needs are met. It's also important to remember that autism is a spectrum, meaning every individual is different. One person's reactions and coping strategies may be completely different from another's. Taking a moment to assess the situation, observe the individual's behavior, and adapt your approach accordingly can help prevent escalation and build trust. In some cases, a person may carry an autism ID card or wear medical alert jewelry identifying their diagnosis, which can help guide your response. Overall, EMS providers who are informed about autism and trained in recognizing and appropriately responding to its various presentations are better equipped to deliver patient-centered care. By practicing patience, maintaining a calm demeanor, modifying the environment when possible, and using thoughtful communication techniques, EMS professionals can significantly reduce stress for autistic individuals and improve outcomes during emergency encounters. When responding to an individual with autism, EMS personnel can take several practical and compassionate steps to reduce stress, build trust, and ensure a safer, more effective interaction. One of the most immediate and impactful actions is to reduce sensory stimuli. Whenever it is safe and operationally appropriate, turning off sirens and flashing emergency lights can help prevent sensory overload, which may otherwise lead to panic, shutdowns, or behavioral outbursts. Many individuals with autism are hypersensitive to noise, lights, and other environmental factors, and minimizing these stressors is a simple yet powerful way to improve the patient's experience. Approaching the individual calmly is also essential. Sudden movements, loud voices, or rushed behavior can be perceived as threatening and may escalate anxiety or defensive reactions. EMS providers should move slowly, speak in a soft and steady tone, and maintain a relaxed posture. Eye contact should not be forced, and it's important to respect personal space, allowing the individual time to adjust to the situation. Limiting the number of personnel directly interacting with the patient can also help. A crowded scene with multiple voices and people can be overwhelming, so designating one calm, clear communicator, while the rest of the team supports from a distance, can be more effective. Whenever possible, consider assigning a provider with autism training or pediatric experience to take the lead in communication. Observation plays a key role in identifying how best to support the individual. Look for visual cues such as facial expressions, body posture, repetitive behaviors, or signs of distress. These nonverbal signals can offer insight into how the patient is coping and whether they are becoming overstimulated or anxious. In many cases, individuals may carry communication aids, autism ID cards, or use visual communication tools that can help bridge any language or social gaps. Equally important is caregiver involvement. If a parent, guardian, or caregiver is on scene, they can often provide crucial information about the patient's communication style, known triggers, calming strategies, medical history, and baseline behavior. Caregivers may also help explain procedures to the patient or serve as a calming presence. Their input should be valued and incorporated into the care plan whenever feasible. Incorporating these strategies into EMS practice not only improves the care of individuals with autism, but also enhances overall scene safety and efficiency. By approaching these patients with empathy, flexibility, and a willingness to adapt, EMS providers can create a more supportive environment, reduce the likelihood of behavioral escalation, and promote better outcomes during emergency encounters. When communicating with an individual who has autism, it is essential for EMS personnel to approach the interaction with patience, clarity, and flexibility. One of the most effective strategies is to use simple, clear, and direct language. Avoid medical jargon, slang, idioms, or abstract phrases, as these can be confusing or misinterpreted by someone who processes language differently. Stick to short, concrete sentences, focusing on one instruction or idea at a time. For example, saying, "Please sit down," instead of, "Let's get you settled and comfortable over here." It's also important to allow extra time for the individual to process what has been said and to respond. Some people with autism may need a few extra seconds or more to comprehend verbal communication and formulate a response. Interrupting or repeating the question too quickly can create unnecessary pressure, potentially leading to shutdowns, increased anxiety, or miscommunication. Remaining calm and giving the person space to respond in their own time can make a significant difference. In addition to verbal communication, visual aids and gestures can enhance understanding, especially for individuals who are nonverbal or have limited speech. Simple pointing, demonstrating an action, or using picture cards, if available, can clarify instructions and reduce confusion. EMS personnel can also hold up objects being discussed, for example, a blood pressure cuff or stethoscope, to help the patient understand what is happening next. Visual schedules or communication boards, if present, may also assist in creating structure and predictability during care. If a caregiver, parent, or companion is on scene, their input should be actively sought and respected. Caregivers often know the patient's preferred communication methods, calming strategies, sensory triggers, and what types of instructions work best. They can act as interpreters, advocates, or emotional anchors for the patient. Asking questions like, "What's the best way to explain this to them?" Or, "Are there any words or signs they use to express pain or discomfort?" can provide valuable guidance that helps tailor your approach. Additionally, it's important to monitor your tone and body language. A calm, reassuring tone and a relaxed, non-threatening posture can help put the patient at ease. Sudden changes in volume, facial expressions, or hand gestures may be misinterpreted and increase distress. Always approach interactions with empathy, flexibility, and a willingness to adjust your communication style to meet the individual's needs. These mindful practices not only improve communication, but also foster a safer, more respectful environment during emergency care. For EMS workers, recognizing the signs of sensory overload in individuals with autism is essential to providing effective and compassionate care. Sensory overload can be triggered by loud noises, bright lights, unfamiliar people, or even certain textures and smells, many of which are common in emergency situations. These overwhelming stimuli can cause a person with autism to shut down, become nonverbal, or react with agitation, fear, or even aggression. It's crucial for EMS providers to stay calm, observant, and patient, and to adapt their approach to minimize distress. Avoiding unnecessary confrontation is key. This includes limiting physical contact unless absolutely necessary, avoiding sudden movements, and giving the individual space when possible. Clear, simple communication can also reduce anxiety. Use short phrases, speak slowly, and allow extra time for processing and response. Whenever possible, offer calming strategies such as dimming lights in the ambulance, turning off sirens when safe, or providing comfort items like a blanket, toy, or noise-canceling headphones. Allowing caregiver support can be one of the most helpful strategies. Caregivers often understand the individual's specific triggers, calming techniques, and preferred methods of communication. Involving them in the assessment and care process not only builds trust but also significantly improves outcomes. Overall, by taking the time to adjust their approach, EMS personnel can ensure that individuals with autism receive the respectful, patient-centered care they deserve during stressful and potentially traumatic emergencies. When providing care to individuals with autism, EMS workers should be especially mindful of behavior considerations to ensure a safe, respectful, and effective interaction. One of the most critical components of this care is the ability to recognize signs of sensory overload. Individuals with autism may become overwhelmed by stimuli that are common in emergency situations, such as loud sirens, flashing lights, strong odors, or even physical touch. Signs of sensory overload may include behaviors like covering the ears or eyes, rocking back and forth, repeating words or phrases, becoming nonverbal, or exhibiting sudden agitation or outbursts. Recognizing these behaviors early can help prevent a situation from escalating. To minimize distress, EMS personnel should avoid unnecessary confrontation. This means approaching the individual slowly, avoiding sudden movements, speaking in a calm and reassuring tone, and limiting physical contact to only what is necessary. If restraint or treatment is required, it should be explained in clear, simple terms, with extra time given for processing and response. Creating a calm and predictable environment whenever possible is also important. Reducing ambient noise, dimming lights, and minimizing the number of people in the immediate area can help lower stress levels. Utilizing calming strategies can make a significant difference in managing behavior during an emergency. Offering comfort items such as a favorite toy, blanket, or noise-canceling headphones may help the individual feel more secure. Allowing the individual to engage in self-soothing behaviors, such as fidgeting or repetitive motions, can also be helpful unless they pose a safety risk. Equally important is allowing and encouraging caregiver support. A parent, guardian, or caregiver can provide critical insight into the individual's specific needs, communication preferences, and effective calming techniques. Their presence can serve as a stabilizing influence, helping the individual feel safer and more understood. Caregivers often have strategies and cues that can guide EMS personnel in delivering care that is both compassionate and effective. By considering these behavioral factors, EMS providers can greatly improve the quality of care and reduce the emotional impact of the emergency experience for individuals with autism. EMS workers must always respect every patient's rights, regardless of their communication abilities, cognitive level, or behavioral presentation. This includes patients with autism, intellectual disabilities, or other developmental conditions, who may experience emergencies differently than neurotypical individuals. These patients are entitled to the same ethical and legal standards of care as anyone else. EMS personnel have a responsibility to ensure that their approach is respectful, compassionate, and based on a clear understanding of the patient's needs and rights. In high-stress situations, it's easy to prioritize speed or protocol, but maintaining patient dignity must remain a core priority. Every individual deserves to be treated as a person first, not defined by their diagnosis or behavior, and EMS workers play a critical role in making that happen during emergency responses. One of the most complex and important aspects of this is understanding consent, particularly with nonverbal individuals. Just because a patient does not use spoken language does not mean they cannot communicate. Nonverbal patients may use gestures, facial expressions, eye movements, vocalizations, assistive communication devices, or other forms of behavior to express their wants and needs. EMS providers should take time, when possible, to observe these cues and attempt to engage in alternative methods of communication, such as using visual aids or confirming understanding through caregivers. If a nonverbal individual is clearly resisting care, such as pulling away, vocalizing distress, or becoming agitated, those signals should be taken seriously and documented appropriately. Consent in these situations may not look traditional, but efforts to obtain it and recognize the patient's responses are essential to ethical care. In situations where care must be modified to accommodate the patient's unique needs or where standard protocols are adjusted to reduce trauma or increase cooperation, these changes must be thoroughly documented. For example, if a patient with autism cannot tolerate being strapped to a stretcher or needs to be transported with a caregiver present, those adaptations should be explained clearly in the patient care report. This documentation protects both the patient and the EMS providers by outlining the rationale behind clinical decisions, demonstrating that care was tailored to the individual rather than arbitrarily altered. It also provides valuable context for receiving facilities, helping them prepare for the patient's arrival and continue care with a trauma-informed, patient-centered approach. Equally important is avoiding unnecessary restraint, particularly for patients with autism or behavioral health needs. Restraints can be deeply traumatic and, in many cases, counterproductive, escalating fear and agitation rather than increasing safety. Physical restraint should only be used as a last resort, when all other de-escalation strategies have failed and when the patient presents an immediate threat to themselves or others. EMS workers should be trained in nonviolent crisis intervention techniques and should always attempt verbal de-escalation, environmental adjustments, and calming strategies before resorting to restraint. If restraint is used, it must be the least restrictive option necessary, applied with care and constant monitoring, and documented with a clear justification that includes details of the situation, attempts to de-escalate, and how the patient was monitored throughout. By committing to respectful, informed, and compassionate care, EMS providers can uphold the rights of all patients, regardless of their ability to communicate or the challenges they present. Understanding the nuances of consent, documenting with clarity and transparency, and minimizing the use of force are all essential components of ethical pre-hospital care. These practices not only support the physical and emotional well-being of patients but also build trust with families, communities, and healthcare partners, reinforcing the role of EMS as advocates for health, safety, and human dignity. When caring for patients with autism, EMS workers must be prepared to adjust their approach to meet unique behavioral and communication needs. Autism spectrum disorder, ASD, is characterized by a wide range of behaviors and sensitivities that may affect how an individual responds to emergency situations. Recognizing behaviors associated with autism, such as difficulty with verbal communication, repetitive movements, sensory sensitivities, or atypical reactions to touch or sound, is the first step in providing appropriate and compassionate care. These behaviors are not signs of defiance or non-compliance, but expressions of how the individual processes the world around them. By identifying these behaviors early, EMS personnel can respond in ways that de-escalate rather than intensify the situation. One specific strategy EMS workers can use is to avoid direct eye contact when interacting with an individual with autism. While eye contact is generally considered a sign of attentiveness or respect in neurotypical communication, it can feel threatening, overwhelming, or uncomfortable to someone on the autism spectrum. Instead, EMS providers should maintain a calm, relaxed presence and focus on using clear, simple language and body cues to communicate. Approaching the patient from the side rather than directly in front of them may also reduce anxiety and help the patient feel safer. Explaining procedures before performing them is another critical consideration. Many individuals with autism thrive on routine and predictability, and unexpected physical contact or medical interventions, such as taking vitals or applying oxygen, can be distressing. Before initiating care, EMS providers should take a moment to explain what they are going to do, ideally in a way that the patient can understand. Using short sentences, visual cues, or even allowing the patient to touch the equipment first can build trust and reduce fear. Whenever possible, involve the caregiver in these explanations, as they can often translate unfamiliar situations into something more manageable for the patient. Unnecessary restraint should always be avoided when treating individuals with autism. While certain behaviors may appear aggressive or uncooperative, they are often rooted in sensory overload, fear, or a lack of understanding about what is happening. Physical restraint can escalate these responses and may cause trauma, injury, or a loss of trust in healthcare providers. EMS workers should use de-escalation strategies such as reducing noise and light, allowing personal space, offering comfort items, and involving caregivers before resorting to restraint. If restraint becomes absolutely necessary for safety, it must be the least restrictive method available, carefully monitored, and thoroughly documented. Above all, EMS personnel must respect every patient's rights, regardless of how they communicate or behave. This includes the right to informed consent, dignity, and individualized care. Patients with autism are entitled to the same legal and ethical standards as any other patient, and it is the responsibility of EMS workers to uphold those rights in every encounter. By taking the time to understand autism-related behaviors, avoiding potentially triggering actions, clearly communicating procedures, and prioritizing respectful, patient-centered care, EMS providers can deliver better outcomes and build meaningful trust with patients and their families. Thank you for completing this lesson. We hope you found the course informative and valuable. Please proceed to the post-test to assess your knowledge of the topic. And that you for visiting EasyEMSSU.com.